Okay, let's get started. Hello, all. Thank you so much for joining. Since this is a pretty small group, let's just do like a round of introductions in the beginning. I can start with myself, and then I'd love to get to know a little bit about you as well. What you guys are up to right now, what got you interested in the hackathon, etc. Just a little bit about me. My name is Maitreyee Joshi. You can find me on my LinkedIn here, or I also have a newsletter specifically about AI and healthcare called The Prescription. And so you can read that also if you're interested in this space. I work as a product manager at Path AI, as well as I'm the co-founder and CTO of Caspia Health, which is an AI and healthcare startup. I previously worked at Microsoft, Disney Imagineering, and Stanford. I would love to get to know a bit about you as well. If you guys want to take turns and like unmute yourself and introduce yourself, that would be great.
Okay, hi, I'm Ognik. So in my free time, I participate in Kaggle competitions and like some projects I've done in the past is detecting the grade of cancer in prostate biopsies. So I guess it's kind of similar to yeah, this, but yeah, nice meeting you all.
Super cool. Nice meeting you too.
So there's actually four people here. We're all a group of friends
Mhm.
who live in Massachusetts, and we like to experiment a lot with AI and machine learning. And our recent project in a hackathon was like creating a mask detector. So like it would detect if a person was wearing a mask, and it would open the door or send an email based on the results.
Wow, super cool.
Hi, my name is Anvith. I live near Washington, D.C. I'm actually fairly new to programming. I just learned Python and a good chunk of Java.
Nice. Anybody else want to go and introduce themselves?
Hi, my name is Tejas. I live near San Francisco, and I know a little bit of Python and JavaScript and HTML and CSS, but I've never experimented with machine learning, so I'm excited to watch this.
Cool, cool.
presentation.
Good to hear.
Hi. So my name is Srinikit. I live here in Philadelphia, and so I primarily do like Swift, so mobile development. And I haven't actually experimented with AI yet, but I like hope to like I don't really know how to code it, so I hope to learn more about that now. So yeah.
Oh, cool. Cool. Anybody else on the call want to introduce themselves? I know there's a couple people that haven't gone yet. Okay, well, let's move on for now, and then hopefully, I do want to make this session very interactive, and so I hope that throughout the session, all of you guys will be contributing and answering questions. So do, yeah, try to be paying attention for that. Well, so thank you all so much for coming out here. It's really exciting to see how many young people are already like so advanced in their programming and like AI machine learning skills, and like are so proactive about coming to this hackathon on a weekend and achieving a lot. So, uh, great stuff to see. Some things that I'm going to be covering throughout this talk. This is going to be more of a high level talk. So I'll give you a brief overview of what the AI and healthcare space looks like, then do a deep dive on how AI is actually used to help diagnose and treat cancer currently. And then give you some tips about like how you should go about building AI and healthcare products yourself, because I think this is a pretty different space than building products for the general tech world, and especially if you do ever want to make a startup in this space. I think there's a lot of key things that you need to know in order to make your product really successful. And then lastly, I'll end off with some closing thoughts about what some of the good opportunities that I think are in this space are. As I mentioned, I do want to make this talk as interactive as possible. So if you have questions throughout the talk, feel free to, just unmute yourself and ask your question. I do also have some questions throughout the talk as well. So please put your answers through the Zoom chat. Or I guess because this is a pretty small group, we could also just like, you can unmute yourself and say what your answer is. There's no correct answers, so don't worry about that. A lot of these questions are more just to like get you thinking. Um, cool. And so a brief overview of the AI and healthcare space. So these are the major categories within the AI and healthcare space. And so, as you can see, AI in health is applied to healthcare from anything that is very patient-facing, such as like mental health, remote monitoring, to helping pharma companies do their jobs better. So, like finding drugs faster, that's drug discovery, to virtual assistants. And so, there's a broad range of like applications to AI in the healthcare space. And so let's look at a specific example of how AI is actually used to help diagnose and treat cancer. So the current status quo of how you go about diagnosing and treating cancer is typically a patient will give a tissue sample. The pathologist will examine that tissue sample. So pathologist is a person who diagnoses diseases. And then the patient will get back a diagnosis and then treatment options, and then they will usually start treatment. So if we look at this more in depth, what happens is, say one day a woman wakes up and she finds a lump on her breast, right? So she will typically go to the doctor. The doctor will take out using a needle, like a small piece of the breast tissue. They will put it onto this whole glass slide right here. And then the pathologist will look at that under a microscope. And so they will see this kind of tissue sample. And their job is quite difficult, right? So there are about 500,000 to 1 million cells on a slide that they have to examine. And then based on that, based on examining this entire slide, they have to give a single diagnosis of like, yes, this person has cancer, or no, this person doesn't have cancer. Um, and this is really hard to do because they have to look at like the size of the cells, the shape of the cells, the location of the cells, and like all in conjunction with each other. And just to give you an idea of how difficult this is to do, say I gave you this map of Boston, and I told you that I want you to tell me whether the percentage of if the percentage of cars within this map, over 10% of the cars in this map have some kind of blue marking on them, and also are located near a stoplight, right? And by the way, you only have about 5 minutes to do this. Right, and like this is really hard, right? Because you have this huge image. Now you have to go about finding the total number of cars within the entire image to figure out what 10% of those cars means. The blue marking on that car could be anywhere, and so it's really hard to find. You have to examine each car, very well, and then even once you have to also check whether it's actually near a stoplight or not. So these are a lot of different steps that you have to do, and you are very time constrained. And so now say the pathologist does all of this and they give a diagnosis. And so unfortunately for the woman, the diagnosis is positive, and she is suggested a treatment option of chemotherapy with the drug Herceptin. Right, I mean, this sounds pretty good. Now she has a treatment option to go treatment. And the pros that she is told is that this drug is very effective if she has too much of the HER2 protein, right? So it's a specific type of protein. And so if she has too much of this protein, the drug will work miracles, and her prognosis is very good. She will most likely get better. But the problems are that only 20 to 30% of breast cancer patients actually have too much of this HER2 protein. And not only that, there are really bad side effects to this drug. It causes heart failure in about 2 to 7% of the cases, and it costs about $70,000. So not only are there pretty low chances that this drug will work for this woman, um, there are also high chances that it actually might have fatal side effects. Right, and this is a pretty bad problem, right? You would want to know whether a drug is going to work for you before trying that drug. And so this is not just a problem for this drug in particular. This is true throughout the industry. So in general, about for cancer drugs, typically a drug only works in 25% of the people, and so 75% of the time it just doesn't work. And this has pretty bad side effects, negative. And so adverse drug reactions are actually the fourth leading cause of death, causing over 100,000 deaths annually. And so this is right behind heart disease, cancer, and stroke, right? And so it takes away a lot of lives. And so kind of seeing all of this, seeing the problems in this space, what do you guys think? Like, what do you think, how do you think we can help improve this cancer diagnosis and treatment process with AI? Is there a way that we can make this a lot better?
Maybe use AI to make like the doctor's life easier when they're trying to find the cancer.
So how would you recommend that? Like, what would how would you help them? How would you make their lives easier?
Because like as you said, there are like millions of cells
Mhm.
possibly in that tissue,
Yeah.
and it'll take them a long time or it'll take a lot of time and effort to find if they have cancer. So
Yeah.
you can
Yeah.
use AI in that.
You're definitely on the right track. Any other thoughts? There's a lot of different answers for this. So yeah. Anybody else?
Maybe like to use it to find like the best drug treatment for the person by examining the cells.
Yeah, that's a really good idea. Cool. Any other thoughts on how would we go about doing this? Cool. So yeah, you both were on. Sorry.
Okay, I was gonna say like we could use computer vision and AI to like help detect the patient's symptoms, because like as you said, there's like the adverse symptoms of the cancer treatment are like cause a lot of deaths. So if we can identify it early, maybe they could go back to the hospital to get as much treatment as possible.
Interesting. Okay, so then how would you detect the adverse symptoms using AI?
Uh, um,
These are like
I do not know yet.
yeah, okay, cool. Yeah, so these are all really great ideas. And so you guys are all like on the right track. And so pretty much one of the ways that uh, AI is used with this cancer diagnosis and treatment process currently is, like you said, you have this whole slide image, right? There is a lot of information on this whole slide image, 500,000 to a million cells, and we're actually not using a lot of that information currently, right? We're reducing all of this enormous information down into just one number. But what if we could actually extract a lot more important information? And so what we can do is using computer vision, we can actually identify whether that person has too much of that HER2 protein or not. And so we can train a computer vision algorithm that will detect what a normal cell looks like this is the one on the left, versus what the one on the right looks like, which is you see too many HER2 proteins, or you see all the yellow spots here. And so you can develop a computer vision algorithm to do that. And then it will tell you, okay, this is the percentage of, or this is how much HER2 protein this person has. And then based on that, pathologists can make a decision of whether it is good for that patient to actually use this drug or not. And as you can probably tell, this is useful for a lot of different people, right? So it's useful for pharma companies, because now they can tell essentially what pharma companies want, right, is they want to make their drug used by as many people and like be effective as many people as possible. And so now if they can tell which patients a drug is going to be effective in versus not, then there's a higher likelihood that their drug will actually pass through all the clinical trials and get accepted by the FDA. And this is also really useful for pathologists because now they can give better treatment options than they could before. And so it's a pretty exciting space, and I think all of this kind of leads into the whole domain of precision medicine, which I think is really exciting. And I think AI can play a huge role in this, which is where now instead of having these treatments and diagnoses that are very general to the entire population, we can design diagnoses and treatments that are very specific to each person. And we can tell with a good amount of confidence whether something will work in that person before even trying. Um, and so I think this is like pretty exciting for the future. And I think AI has like a huge, huge, huge role to play in it. And so now, if you are interested in building AI and healthcare products, how would you go about actually doing that? So building products for healthcare, especially AI products, I think is very, very different from the tech space. There are a lot of different incentives that are involved, a lot of different players that are involved. And I think before you start building, it's really important to understand all of these so that you actually build a product that's being used by people instead of building something that's really technically challenging and really cool, but ultimately people are not going to use because of some of the quirks in the healthcare space. Um, and so the very first step when you are building for the healthcare space is you want to identify who your users are. And so your users will typically fall into one of these four groups. So you have either your patients, your providers, who are anybody who's like actually giving the care to the patient. So this is going to be your doctors, your hospitals, or also your labs who are doing like the blood tests or the pathology tests. Then you have your payers, or the payers who are paying the providers. So these are like insurance companies, employers, the government, individuals. And then you have your vendors, which are the ones who are providing services to the providers. So they could either provide drugs, like pharmaceutical companies do, or like medical equipment, like the beds and all that stuff. And so then the other important user is sometimes the providers and the payers are combined into one group. This is called a health maintenance organization, HMO, or an accountable care organization, ACO. And so in this case, so some examples of HMOs, ACOs are either Kaiser Permanente, if you guys have ever been there, or UPMC. This is usually where both the insurance company and the provider are both working together. They're like within one system, and this is usually done to like manage risk and to like align the incentives between all of the players. Then the next step, once you've figured out who your users are, is to identify who your customers are going to be. And so your customers might be different, or typically are different from who your users are. And so say you're building something for say like patients to help manage their diabetes, right? Your users might be your patients, but your payers might be your insurance companies, because the insurance companies care that the patients manage their diabetes better, because then they will have less health complications later down the road, and then therefore the insurance companies will save a lot of money. Or even within the same group, say you're building something to make doctors' lives a lot easier. Their workflow is a lot simpler. Um, so your users might be your doctors, but your customers might actually be the chief information officer of the hospital, right? Because they're the ones who are making all the paying decisions for the hospital. And the reason why it's important to understand the difference between your user and your customer when you're building any kind of AI product is because they usually have different incentives. And so you want to make sure that you keep that in mind, so that you're building a product that people will be willing to pay for. Right. So, for example, a doctor, what they might care about a lot is making their lives a lot easier, right? Like having something that's like a really usable workflow that's very simple to use. But since the person who's paying for this product is probably going to be the chief information officer, their top priority may not be usability, right? Their top priority might be something like, oh, like their top priority might be just improving the bottom line, right? Because that's the main metric that they're measured on. And so it's important to keep this in mind when you guys are working on a hackathon or if you are working on a startup or something, because if you don't understand these kind of incentives, you end up typically building a product that people don't use. And so that kind of sucks. And I've definitely been in that space, so don't want to do that. Um, And so then once you've figured out who your users and your customers are, the very next step is to identify what your value proposition of what you're building is, right? And so typically your value proposition will look like something along the lines of, we will save X number of lives by using, like if you use our product, or we can improve your bottom line by Y% if you use our product. And this seems pretty simple, but I think it's a bit more nuanced than it might seem. And so let's do a couple like case studies to see why it might be a bit hard. And so this is for all of you. So say you have created a tool that uses natural language processing to help doctors record notes in an EHR system using just their voice. Who would you pitch this product to, and how would you convince them that this is something that's valuable for them? Any thoughts?
Oh wait, what's an EHR system?
Yeah, okay, that's a really good question. And so doctors, so typically in hospitals, they have this thing called an electronic health record, which is where they will store all the information about the patient, right? And so if you've ever been to a doctor's office, right, like they're typically like typing up notes on like uh, the system. And so now if like a different doctor wants to pull up your file, they can go to this electronic health record system. They can see what the previous doctor has written about you, so that they can help you better. Does that kind of make sense?
Wait, so so it just writes notes using your voice?
Yeah.
So I think what we like how you could pitch this is that you could say that while the doctor is in like an operation or while it's examining a patient, it can it doesn't have to, the doctor doesn't have to stop, write notes and then go back, and it'll save time to just say the notes as well, because you're also saying that to the patients and everything. So instead of just wasting time and stuff, you have, it's more time efficient and other people can get in faster and at things.
Yeah, no, that's really good. Yeah.
That's really good. Yeah.
Any other
Thanks.
thoughts on
how?
There's no one right answer for this, so. Okay, cool. So definitely along the right lines, right? And so typically what people do is when they are trying to convince people that this is the right, they should buy this like this product, is that they will say, okay, this thing is going to save you a lot of time, right? And the way that we're going to quantify this is by saying that this is the number of additional patients that a doctor will be able to see because they used our product. This is the amount of additional revenue that you get from each patient visit. These are the number of doctors in your company that are using this product. You multiply all of these together, and this is the amount of money that you've gained by the company by using your product. Like this is how much we're going to improve your bottom line. Do you guys see any problems with this kind of value proposition? Something that this might be missing?
But I don't see anything missing.
Yeah. Yeah, so there's a couple of nuances to this that are actually once you work in the healthcare space, you'll kind of learn, right? And so uh, essentially, well, this is kind of important because this is actually one thing that um, I had like kind of laid out this exact kind of equation during one of my like Google interviews, and got torn apart for this. So if you're doing interviews and stuff, this is also like good things to know. Um, so it's actually really hard to quantify that. First of all, so when you build a new like a workflow that's more efficient, right? Um, it might be efficient to say like when you're testing it out in your company, but changing workflows for a doctor because they're so used to what they're doing already, um, and once you try to plug in your new workflow into their system, it actually like ends up not being as efficient as you would have thought because now they have to like relearn how to do things a very different way, right? And so that's kind of one of the things that isn't factored in. Um, and so also just like the healthcare system is so complicated so that like once you get everything plugged into all the different things that it needs to be plugged into, a lot of those efficiencies go away. The other thing is it's also sometimes not actually in the doctor's best incentive to do things the fastest because they are paid using this thing called relative value units. And so if their job becomes a lot faster, they actually might get paid less. And so yes, they're seeing more patients, but the amount of money that they're getting paid per patient from the insurance company might get lower. And so there's kind of these like weird incentives in the system that you have to think about. And so then when you are thinking, so kind of the takeaways, the things that you want to remember, if you're trying to build something that is going to help make somebody a lot more efficient within the healthcare system, is that like efficiency might not always equal to dollars saved. Uh, Payment methods drive adoption a lot, right? And so if people are going to make a lot more money because they use your product, then they will use it. If they don't, are not going to make more money, even if it's a better product, they might not use it as much. And this is partly due to like hospitals already have pretty low margins. And so my suggestion is to always focus on what can't be done by humans instead of trying to focus on efficiency. And so, for example, in the pathology example that I had shown you before with the diagnosing and treating cancer, we weren't just automating what the pathologists were already doing, right? Um, we weren't just like doing the same diagnosis that they were already doing before. What we were doing with this AI model was trying to find information within that tissue sample that pathologists couldn't even like there was no way that they could get that information extract that information out because it was so like counting and numbers and all these things based that computers are a lot better at than humans are. And so my suggestion is always focus on those kind of things where it's okay, a human can't do this thing, but computers can do this really well. And so we're actually opening up new possibilities that didn't exist before. And so another example, say that you have created an app to help use that uses AI to help people eat fewer desserts. This is something that I would definitely need. um, who would you pitch this product to, and how would you convince them of its value?
You could pitch this idea to like patients or people struggling with obesity and stuff.
hmm Yeah, that's definitely a good idea. Any other ideas?
You can tell them like by like eating less desserts, they're like saving money from like the grocery store, like buying the junk food, I guess.
Yeah, that's true. That's very true.
You might be able to present it to like someone's visit or someone's physician, so that they can
hmm
so then they can tell them if they're overweight, and they can say that you can use this app to control how much you eat.
Yeah, that's a good idea. Any other thoughts? Okay, cool. Um, so typically, uh, so typically in general, actually pitching something to patients is kind of hard, because especially if you want them to pay for it, because I mean, especially with like software and stuff, right? I think people have gotten pretty used to not paying for things, and so uh, it's kind of the willingness to pay from the patient side is a bit low, and so typically what people will do is they will try to convince insurance companies. So they will tell insurance companies, hey, if your patients use my app, I can reduce this bad habit of like your patient eating too many desserts by this percent, right? This is how much this bad habit costs you. And these are the number of patients in this insurance company that have this bad habit. You multiply all this together, and this is how much money you're going to be saving by using my product. Do you guys see any problems with this value proposition? Something that might be missing? Or something that that might actually be really hard to measure, even though it looks like simple in this equation.
The amount of like a bad habit is like reduced.
Hmm. Yeah.
Maybe like number of patients in the insurance company with the bad habit.
Hmm. Yeah. No, these are all really great. So yeah, so one spot on. So it is really hard to measure how much a bad habit is being reduced by. And this is because like there can be so many different causes, right? Say something with like eating less desserts, like yes, maybe it was because of the app, but maybe because it was like, I don't know, like colder, or like it was COVID and it was like hard to go outside and like eat more, like there can be so many different factors, right? And so it is really hard to figure out what exactly caused that reduction in that bad habit, right? And also typically insurance company, something like a like eating, desserts, the repercussions of that are going to be very long term, right? You will probably have like problems when you're a lot older, but usually insurance companies don't care about that as much, because but you will usually probably have changed insurance companies by then anyway, so it's not like they're going to benefit, right? Because this is such a long term problem. And so typically what you want to do when you are trying to pitch to insurance companies is to think about like what is a good short feedback loop that you can show, that like you can easily show that like this thing costs something else. Um, uh, yeah, and then it's also very easy to quantify, so you can very easily say that like, oh, my app particularly uh, caused this reduction, and it caused an outsized burden to the customer. So obviously like it needs to be something that causes the insurance company enough pain for them to be willing to pay. So one really good example of something that does all of this is like a diabetes management app, right? Because there you can have some app that helps reduce diabetes for the patient. Then that you can have them like immediately take like a blood test, and so you can measure like what the blood sugar levels are, right? And so you can easily tell, oh, like if the blood sugar levels are going down, this diabetes management app is probably helping. You can quantify that very easily. And diabetes causes a huge problem to insurance companies, because there's all these like heart disease related complications further down the road. Yeah, and so that's kind of the things that you want to keep in mind when you're building products for the healthcare space, especially if you decide to like start a startup or something in this space. I think there's a lot of different really like interesting quirks about the system, and it's like it's good to know what the incentives of all the players are, so that you can build a product that will appeal and be used by people, and people will be willing to pay for it. Okay, so the next step is once you have this product, you've decided what your value proposition is, you need to start measuring success of your product and see whether it's actually working or not. This is also uh, Yeah, a bit more complicated than what you would do if you're building any normal AI product. And so for those of you that have done like machine learning and stuff before, you might recognize this ROC curve. And so typically in any machine learning model that you build, you want to have this curve um, hug the left hand axis and the top the top axis as much as possible, right? This means that you are getting the most amount of correct answers and like least amount of wrong answers there. But just because your ROC curve might look amazing doesn't mean that your AI model is necessarily good. And so there's a couple things that you want to keep in mind. So one thing is just like are you measuring ground truth? So for example, on the left, it is very easy to tell what the ground truth is. Can you guys tell me what this these images should be identified as, like what they should be tagged as?
Dog.
Yeah, exactly. And so now if you look at the image on the right, so these are two different types of eyes. Um, can you and one of them has a disease and which one of them doesn't? Can you all tell me which one has it and which one doesn't?
The right eye looks kind of worse, but that's just a guess.
Yeah, you're actually right. Okay, I'm surprised. But yeah, I mean, it's hard to tell, right? And I mean, usually it's like the special. You have to have specialists, and even specialists a lot of the times will disagree. And so, for example, the cancer diagnosis example that I had given before, the average amount of at the times like usually pathologists will only agree about 60% of the times on what the correct diagnosis should be, right? And so even within specialists, it's really hard for them to agree whether like this is what the actual right label for that image should be or not. And this is a huge problem that you face in the AI and healthcare space is how do um, you have to make sure your input image quality is good and it's tagged accurately. And it's hard to tell that. Okay, and so then the next thing is you usually, I mean, pretty much in anything, you have this like 80-20 distribution, right? You will have some very, very common cases, and then you'll have these like long tail of edge cases. And if you are building a normal kind of AI product, it's okay for you to just do really well in those common cases, and then kind of fail for everything else, right? Because it doesn't really matter that much. Um, but in healthcare, you can't do that, right? You cannot just like if there's like some random like there's like some like disease or like some interesting pattern that you've never seen before, you can't just be like, oh well, I've never seen this, I don't really care anymore. Um, and just give some random answer, right? Because this can affect somebody's life. And so you need to either care about all these long-term cases, long end of cases, and make sure it works for all of them, which is really hard to do, right? Because a lot of these are very rare. Or you need to make sure that you call that out specifically, that it does not work in these particular situations. And then lastly, you need to make sure that the images work. Also, like it, usually when you're testing something in the lab, right, you have amazing image quality, right? Like it is, yeah, just amazing, right? But when you deploy this out into the real world, your image quality is not going to be as good, right? And this has been a problem. So, for example, Google had built this, like, it detects eye diseases, right? Worked amazingly well within the laboratory, had like 94% success rate, was great. But when then they actually tested it out in the real world, in a clinic, like it did really badly, right? And the reason why was because a lot of you don't get the same amount of image quality when you're actually out in person as they did within the lab. And so a lot of the times the algorithm would just reject whatever image that they were inputting into it. And then also like it required really good internet connection, which you don't necessarily always have. So sometimes the algorithm would just not work because it couldn't connect to the cloud. And so you want, when you're designing a product, you want to make sure that you're like resilient to all of that, right? You might have blurry pictures, over focused, under focused. Somebody might just take a picture of something random. Um, your internet connection might be spotty. And despite all of these kind of these cases, your app, your algorithm still needs to work well. And then lastly, like this is a pretty long initiative, right? Yeah, so if you are deploying out a model into the world, typically if you're building any kind of AI model for just like a normal tech company, you can build out an MVP, you can have people test it, and you can kind of just continuously update, right? The product even after you have deployed it. But in the healthcare space, you can't do that. So there's a concept called frozen models, which means that once you have deployed out this model, it cannot, you can't change the, you can't update the model. So that means even if you're getting new training data in and stuff, and you can make the model better, you can't do that. Like it needs to be frozen, it needs to be stay exactly the same. If you want to update the model, then you actually have to like gather all your data, go through like the FDA process, and then you can improve that model based on like the new data that you've gotten. So this is very, very different from what you would do from like a normal AI in like the tech world. Also, you need to do a lot of really good documentation because the FDA and stuff will all probably ask for it. Yeah. So kind of wrapping all of this up, I think the AI and healthcare space is a really, really exciting space. I think it's definitely really challenging, and I think there's a lot of things that you need to think through. But it also has like a tremendous like impact for like making people's lives better, saving lives, and I think it's really cool. And so these are some of the places where I think there are the most opportunities within the system. I think there's a lot of opportunity to make the payment models better. And so, uh, as you can probably have tell, like there are some kind of weird incentives within the system, right? Even though something might be better for the patient, um, people might not be willing to do it because they don't make more money doing that thing. And so I think there's some opportunity to like iron out the payment models so that incentives are aligned. I think there's a lot of potential for personalized medicine, and this is where AI can play a huge role. And so we can design better diagnoses and treatments specifically for different people and make sure that they actually work in them instead of trying to do this like one size fits all approach. I think there's a lot of potential for proactive care. And so instead of like right now, everything is reactive, right? It's you go to the hospital after you have some problem already, then the doctor will diagnose you. But what if we could do all this proactively, right? You do some more continuous monitoring of that person. And as soon as you kind of see any inkling of like something might be going wrong, you can alert the patient that like, oh, hey, I think it's like you should go to the doctor to like get this checked out. So you can catch things early. There's a lot of health data that's available that is not being really made use of. And so I think there's like a lot of potential to use AI there to kind of like go through all of it, see if there's any like new discoveries or new ways that we can help patients better. And then lastly, I think ethics is a huge thing, especially as AI gets more and more involved. You want to make sure that these algorithms work for everybody well. And yeah, so that's definitely like an important part that needs to get taken care of. So yeah, thank you so much for coming. If you have any questions, I would love to hear them.
So how would you recommend like getting started like at this age almost? Like how would you recommend like what we should do almost?
Yeah. So this really depends on like what you're interested in. But I can tell you like what I had done when I was in high school. And so I had done a lot of like science fair projects and stuff then. Um, so one thing that I had worked on was for you know, uh, people that were blind. And so I just went to like a local community center, talked to like the assistive technology officer there, asked them what like some of their biggest problems were, and then worked with them to like build an app for them. And so I would recommend, like, based on whatever you're interested in, like whatever particular space within the healthcare system, try to see if you can find someone it's kind of like more in that space, right? Like there might be actually a patient or like a doctor or something, and see. I think especially like a lot of people love mentoring high school students. See if they'd be willing to talk to you about like what some of the challenges in the space are, and then you can work with them to build a product that will be helpful. I think also like if there are any like local colleges around there, I would recommend like trying to do research in the space as well. I had done like so once when I was in high school, I'd like emailed a bunch of people at Stanford, and had like done a bunch of research there during that time in this space as well.
Sorry, what do you mean by like research? Like as in like you like what do you mean by research almost? Sorry.
Oh yeah. So research like I mean there's a lot of like really cool things that are happening in the research side on um like how do we actually use machine learning for this cancer like for this like healthcare space. So for example, there are like research labs that are trying to build better like natural language processing models, right? Like uh, to help like analyze all of the data within an electronic health record system or like some of the other systems. So a lot of like there's a lot of really cool like it's not really ready for like the industry or like companies yet, but like a lot of really good like preliminary work on seeing what's possible is going on in a lot of research labs. And so if you were to work there as like a high school student, you would probably working like at least what I had done as a high school student was like work on building some of these models for them. Um,
Okay, thank you. That makes sense. So you would like assist a professor or something. Like
yeah, so like I would recommend like emailing like PhD students or like yeah, professors and stuff being like, yeah, I'm like really interested in this space. I've done like whatever projects that you've done on the side. Make sure that like yeah, you can really tell like show off that you can add value. And then say that yeah, like I'm really interested in like yeah, I'm really passionate about the space. I think I can contribute a bunch. And then email a bunch of people and then some people will eventually respond. And um yeah, they can you can work with them and they'll help you like actually yeah do like some cool like cutting edge research in this space.
okay, sorry for so many questions, but like so I live near like UPenn, so would I just like email some of the people there and just like
Mhm.
all right, okay,
Yeah,
thank you.
just email. Yeah, I mean, definitely email a ton. There's going to be a lot of people that are obviously just like never going to respond, and that's fine. But yeah, so just email a ton, and I think the main thing is you really want to show that you can add value, right? And so the more you can emphasize that, like these are all the things that I know, like these are all the programming languages that I know, or like this is all my experience, like these are all the side projects that I've done, the better, because then they will also like see, okay, yeah, this kid is actually um, really good. He like can help us out a bunch as well.
Okay, thank you.
Yeah. Any
Do
other
you
questions?
suggestions of how I could learn machine learning?
Yeah. So that's a good question. So I would first recommend checking Coursera. There is a deep learning specialization, or actually, there's a machine learning course there as well by Andrew Ning. And so I would recommend taking that course. I think it's a very good introduction to yeah machine learning. Yeah. And it's like you can audit it, so it's like it's completely free and stuff as well. Um, but yeah, I think it does a really good job of like explaining it at like in giving you all the tools that you need to like start building without getting too in the weeds. Cool. Any other questions?
So, thanks for having us.
Yeah, well, thank you so much for joining and good luck with the rest of the hackathon.
Okay, thank
Um,
you.
Yeah, it's amazing that you guys are already like thinking about all this stuff in high school. So, yeah,
Mhm.
that's wow, really very impressive to see.
Okay, thank you. Bye.
Okay, thank you.
Thank you.
Thank you.